Hi, my nursing friends. How are you? Hope you are doing well. In this series, we are learning about drugs. So, noradrenaline and adrenaline already covered. If you have not watched yet, please go and watch. Link will be available in the description box. Welcome to my channel, Nursing Med Easy with Titin. So, today our topic is injection dopamine. Dopamine is a primarily used drugs in the critical care units. So, it will be used as a vasopressor and inotropic agent to treat hemodynamic instability. There is a very brief overview on dopamine. Let's start. So dopamine is a neurotransmitter because it affects on adrenergic receptor and dopaminergic receptor also. So in adrenergic receptor, there is alpha 1 and alpha 2. In beta, there is beta 1, beta 2 and beta 3. And in dopaminergic receptor, there is D1 and D2. Dopaminergic receptor is mostly present in the central nervous system and the peripheral nervous system also. So, as we already learned, noradrenaline and adrenaline mostly affect on the adrenergic receptor. But dopamine maximum effect on dopaminergic receptor and very little effect on adrenergic receptor in a higher dose. So let's see. Mode of action. So in case of dopamine, if we start with the lower dose, that is 1 to 5 mcg per kg per minute, that is a lower dose, it will affect on D1, D2 dopaminergic receptor. D1, D2 present in central nervous system and peripheral nervous system also. So that is how it affects as a neurotransmitter. If we increase the dose, okay, so when we start in a lower dose, it will increase renal perfusion, increase coronary perfusion, and it will increase vasodilatation in the renal artery. Okay, this is on a lower dose. There will be moderate dose also. So now we are increasing the dose from 5 to 10 mcg per kg per minute. If we start in this dose, there will be very mild effect on alpha adrenergic receptor. So it will also help to increase heart rate and increase myocardial contractility. Because you already know beta 1 is present in heart. This will be is a moderate dose. Now come to high dose. If we increase the dose, that is more than 10 mcg per kg per minute, there will be effect on alpha adrenergic blocker. It will improve vasoconstriction and it will improve the blood pressure also. Okay. So now we see mild dose will be improve renal perfusion, moderate dose will increase the heart rate and myocardial contractility, and severe the high dose more than 10 mcg per kg will improve the vasoconstriction. That's how it will be improve the BP. Okay, let's go for the medical use. Mostly these drugs used for cardiogenic shock, septic shock, and hypovolemic shock. Why? In this three of the cases, there will be decompromise of renal perfusion. So it will help to increase the renal perfusion. That is why you are using the dopamine to treat in these cases. And acute heart failure also. So cardiogenic shock, septic shock, hypovolemic shock and acute heart failure, all the cases will be using these drugs. And in such cases, if there is an acute renal failure, to improve the urine output, we will use these drugs also. So what is the initial dose for these drugs? Dose, let's come to the dose. Initial dose is 2 to 5 mcg per kg per minute. So 1 vial of dopamine is equal to 5 ml, that is 200 mg. We have to dilute these drugs either with 9% normal saline or 5% of DNS, and you can start according to the 2.5 mcg per kg per minute doses. You can titrate the dose if the BP is not up to the mark or urine output is not adequate as per the patient requirement. What is the contraindication? So if there is any acute tachyarrhythmia, please avoid dopamine drugs because it will also increase the myocardial contractility, to increase the heart rate. So better to avoid in that cases. And if there is any hypovolemia without volume correction. So in case of hypovolemic shock, if you are not replacing the volume but you are using dopamine, there will be the not effectiveness of dopamine. The blood pressure will be not increased, because if myocardial contractility is increased also, there will be no volume of blood for the cardiac output. Okay, so you have to replace the volume first in case of hypovolemic shock and then start the dopamine. Okay, and sometimes in case of a patient is hypersensitive, this is a very rare case to dopamine, all those cases you can avoid these drugs. Let's come to the precaution or nursing management. So for precaution or nursing monitoring, you must care avoid to use or avoid to start these drugs in a peripheral line. Why? It is a very irritable drugs to vein. So if any chances is there for leaking, so there will be high chances of necrosis of those tissue. So better to avoid peripheral lines. Please use in a central line. Monitor heart rate, BP and output also, urine output. Okay, so what is the normal urine output? Let's see once, because we are discussing on dopamine, which is very important to treat the acute renal failure patient. Normal urine output is 1 ml per kg per minute. So let's take examples. If patient body weight is 60 kg, the urine output should be 60 ml per hour. So 1 ml per kg per hour. If body weight is 60 kg, so it should be 60 ml per hour. That is the normal. And what is the alarming urine output? If patient is not adequate urine output is there, what should be the alarming urine output? If it is less than 0.5 ml per kg per hour. Take examples. If patient body weight is 60 kg and patient urine output is less than 30 ml per hour, it is the alarming for these patients. Okay, so whenever you are using dopamine to treat hypovolemia or hemodynamic instability, please monitor the urine output, which is very, very important. If it is not adequate, inform your ICU doctors also. Okay, and what are the things you have to monitor? There is a chances of arrhythmia. So heart rate for any tachyarrhythmia and electrolyte imbalance. Okay, and lastly, try to don't stop the medicines directly. Taper the medicines or titrate the medicine dose according to the patient vitals or hemodynamic stability. You can titrate the dose, you can reduce the dose, and after one you can stop the medicines. Okay, I hope you understand in the dopamine very briefly. So thank you for watching. If you like it, please subscribe my channel.